Through IHI's research into what it takes for health equity leaders to be successful, researchers identified necessary components of success, which are organized into tiers. There are 3 tiers: core way of being, skills to cultivate, and conditions for success. In terms of skills to cultivate, there is a list of observable skills that are extremely helpful, if not essential, for health equity leaders to have. The skills to cultivate are depicted as the middle ring of the health equity leadership framework, and it's surrounding the core ways of being and within the conditions for success. We call these skills to cultivate for a reason. Most health equity leaders enter their roles stronger in some areas than in others. Whether you consider yourself a novice, an expert, or anything in between, there is always room to learn and to improve. This video will review the 8 skills to cultivate. First, you must be able to contextualize present-day equity issues. So, for example, with knowledge of the history of racism, its persistence, and white supremacy tactics in and outside of healthcare. I know how incredibly important it is to understand not only the history of racism at large, but its manifestations in systems and structure. I have spent years researching and publishing on this. I've experienced the necessity of understanding an institution's role in perpetuating inequities and its history in relation to the community, and how all of this intersects and shapes any practices, programs, or partnerships that I will be involved with and witness. This perspective is central to the success of all that you desire to do. Second, you must be capable of leading meaningful and often large-scale quality improvement initiatives. Third, you must be able to make the business case for equity. Fourth, you must be able to learn from data and to use that data to inspire change. Key to using data effectively is recognizing the various forms of data and data collection methods, and that data must be stratified in order to make meaningful progress on equity outcomes. It's just not enough to collect data. You must use the information to make data-driven change. This means strategically using it to transform systems and overcome the structural barriers to accelerating health equity and racial justice. Fifth, you must be skilled at building partnerships and coalitions. A health equities leader's success is dependent on their ability to both learn from and to galvanize others. Sixth, you must excel at listening to others and be able to share power. Sharing power is an important act of trustworthiness. Building productive relationships requires listening actively and knowing that the expectation is both hearing and doing. Because much of our work is rooted in and being with communities that have been racialized and historically excluded, it's paramount that we bring community into the conversation and center what we hear from the community in our work. I've implemented this strategy through working with community advisors and community-engaged research and community-led initiatives. And I've also brought it to the table in complex partnerships, in transdisciplinary teams, and in spaces where there is imbalance in regards to hierarchy or privilege. Seventh, you must be able to navigate emotionally challenging work and to be able to equip others to do the same. Doing this work will have an illuminating effect on your internal equity journey, including where you have work to be done. You must be able to navigate these challenges to demonstrate emotional consistency and be able to support others in doing the same. And finally, you must be able to engage productively in difficult conversations, playing different roles as the situation requires. The work and the decisions you'll have to make are hard. You need to be able to call people into the space by speaking truth to power and through truth-telling in general, with courage and diplomacy. Making change will require courageous conversations, difficult decisions, and situations. That's part of the work. And if it were easy, it would have been done already.